Welcome to the deep dive. There's just so much information out there, it's overwhelming, right? We all want to cut through that noise, get properly informed, and that's what we do here. Today, we're digging into something with huge potential: process mining for healthcare. PM4H for short. Basically, it's about using some pretty smart analysis techniques on the data hospitals and health systems, well, the data they already collect day in, day out, to understand how things really work.
And it's so vital, particularly in healthcare. Hospitals generated just a massive amount of data. Think about it: patient check-ins, exams, treatments, everything. But surprisingly, process mining isn't really used systematically outside of research projects, which is a shame because the potential is huge. You could really help healthcare nail its quadruple aim.
Ah, the quadruple aim. Remind
Yeah,
us.
it's about improving population health, making the patient experience better, reducing costs, which is always critical, and importantly, boosting the work-life balance for healthcare staff, making things better all around.
Okay, got it. So for our discussion today, what are we trying to unpack for you, the listener? What's unique about these healthcare processes? And I guess, what are the big hurdles to making this technology really work?
One of the biggest things you hit immediately is just the incredible variability. It's not like a factory assembly line. Every patient is different. Different conditions, other health issues, even just their personal preferences mean, yeah, the steps involved can change a lot.
Right, and that leads to those spaghetti models you hear about. It's just a tangled mess when you try to map it all out.
Exactly. Like a drawer full of tangled cables. It looks chaotic.
So how does PM4H help there? Does it just ignore the mess?
No, that's the clever part. It doesn't just simplify by throwing things out. It can actually find the most common routes patients take, even within that chaos. And maybe more importantly, it helps pinpoint the bottlenecks, the unnecessary steps that cause some of that variation. So you can streamline things without losing that personalized care.
Interesting. So it's not about forcing everyone down one path.
Not at all. And what's really fascinating, I think, is how it treats what you might call infrequent behavior.
Mm.
In other areas, you might filter that out as just noise, right?
Mhm.
But in healthcare, those unusual paths often contain really valuable insights. They might show critical workarounds staff are using, or maybe highlight systemic problems, obstacles they face every day. It's about understanding why people deviate.
That's a really different way of looking at it, but isn't there a tension there between needing some standard procedures for safety and quality, and then these deviations, like those break the glass moments where a doctor has to go off protocol because of an emergency or something unexpected? How does process mining handle that?
That's a great question, and it really shows the power here. PM4H doesn't just flag deviations as, mistakes. It can analyze the context, the conditions leading up to that break-the-glass moment,
Hmm.
and importantly, the outcomes. So you get data-driven insights. Maybe the guidelines need refining. Maybe understanding why it happened helps prevent future emergencies. It tells you the story behind the deviation.
Okay, so it embraces the complexity rather than fighting it. But understanding these processes, that relies heavily on the data, doesn't it? What are the challenges there?
Absolutely. The data is key, and, well, healthcare data comes with its own set of challenges. It's obviously highly sensitive, confidential. But beyond that, data quality can often be, let's say, inconsistent. You might have missing steps in the record, timestamps that aren't quite accurate, maybe different doctors recording things slightly differently.
Ah, so the event logs, the digital breadcrumbs of the patient journey might be messy.
They can be, yes. Missing crumbs, crumbs in the wrong place. And that obviously impacts how reliable the insights are. It's not just a tech issue. It directly affects the analysis.
I can see that. And I bet some listeners are thinking, okay, if the processes are super variable and the data is messy, how is this more than just, an interesting academic idea? Can it actually do anything useful?
That's the crucial question, isn't it? And here's the profound insight, maybe a bit ironic. PM4H can actually help diagnose those data quality problems itself. It can pinpoint where the data is patchy or inaccurate and even suggest why. This allows for targeted improvements right at the source, making the data better over time. And connecting this to the bigger picture, process mining tools and methods have to keep evolving alongside healthcare itself. Think about new tech like mobile health, personalized medicine. These constantly change the landscape. PM4H needs to adapt to provide insights for these new realities.
Right, it's not a static thing. Which brings us towards wrapping up. It sounds like, despite the real challenges, data quality, that inherent variability, the need to keep adapting the potential here for evidence-based improvement in healthcare is just immense.
It really is. But moving it forward, making it standard practice, that requires real collaboration. You need the data experts and the process analysts working hand in glove with the clinical experts. That symbiosis is key.
Absolutely. Okay, let's leave our listeners with something to think about. Here's where it gets really interesting, I think. Given how quickly healthcare does adapt and change, what new kinds of data, maybe stuff from mobile health apps or real-time sensors on wearables, what data sources do you think will most dramatically change how we understand patient journeys in the next few years? Something to ponder.